So Dr. Ros Jones, what's brought you to Downing Street this afternoon?
Well, I'm here with a group of colleagues representing hundreds of senior health professionals who are appealing to our new Prime Minister to halt the rollout of vaccines for healthy under-18s.
The thing that really got me involved in this COVID problem was when they suggested vaccinating children, because it was obvious that that was not necessary in any way. If we compare an 8-year-old to an 8-year-old, the 8-year-old is about 10,000 times more at risk than COVID than the 8-year-old. So we shouldn't be treating them all the same. The other thing is these new vaccines, these genetic mRNA vaccines injected into growing bodies, we've no idea what they will do long term. So we should pause.
So what I would add is that I think the word vaccine has been abused a bit here, and the public understanding of the word vaccine is it's something that will prevent an infection. And just because that word has been attached to what is a novel drug, people are assuming that it's as safe as all the previous vaccines. Now, the MHRA at the outset had a really good plan for actively monitoring the safety. They were going to do active surveys of people before they had them. They were going to check GP records to see if there were any signals, and none of that's being published. And when such work has been published in other countries, it has shown worrying signals. And so I think there is no need to be rushing to continue to vaccinate people. We need to stop and assess what kind of data is being produced thus far with regards to safety.
I can see no justification for vaccinating children with this vaccine, which has not actually been shown to be of hardly any use at all in preventing transmission. So why on earth would you give it to a child who has a very, very healthy immune response? Indeed, children have a very healthy T-cell response which controls all respiratory viruses. And we're trying to give them a vaccine which boosts antibodies, which they really do not need, and if anything, causes problems. I've seen it in my own circle of friends. People have become very ill after having a vaccine they did not need.